Hi, I'm Dr. Kuhn from Providence Chiropractic Clinic, and today I want to tell you about how things work in our office, what kind of care we give, what kind of decisions we make on whether we accept a patient or not, and basically how the whole process works. Now, to start off with a brief explanation, the short version of what we try and do when you come into the office is we try and put your head on straight. We adjust right up at the top of your neck. It's the very top bone in your neck. It's called the atlas bone. We adjust at that level for two big reasons. One is that the atlas bone is your most likely bone to become injured in your spine, and that's because it's the least reinforced. Every other bone up and down your spine, your atlas bone sits right up top here. Every other bone right up and down your spine has a big chunk up front called the vertebral body. That's held to the ones above and below by the discs and ligaments in between. And then at the back, you've got interlocking and overlapping facets or joints going up and down each side. So there's a very limited amount any of those bones are able to move before they hit pretty solid reinforcements that help stop them and pull them back into place. Now, your atlas bone is unique because it doesn't have any of those features. It's a ring of bone that looks like this one. It sits right up under your skull, kind of there, and it pivots on a piece that comes up from the bone below, which is called your axis. And it's called that because it's the axis of rotation. Your atlas sits on top of that, and it pivots on that bone and is able to move actually quite freely. So there's a lot of rotation and movement and action that can happen up at that level as compared to anywhere else in your spine. Now, the other reason we focus on adjusting in that area is that it's also the most important bone in terms of position, which makes sense because your brain is up here and the rest of you is down below, and your atlas is the door right between the two. Now, on top of that, we know it's the most important bone because there's evidence of it. They've done studies where they've done tissue studies of the body, and what they've found is that there's a higher density of proprioceptive or position sensing nerve fibers in the muscles that connect directly to your atlas bone than you have anywhere else by a factor of at least 5.